COVID-19 cases on the rise again, but there's still confusion over who should get the latest booster. So we did reach out to several doctors to try and get some clarity for you.
I spoke with ABC Action News reporter Larissa Scott. She joined us now in studio this morning with more. Good morning, Larissa.
Hey, good morning to you. And James, well, doctors expect to see more COVID-19 spread over the coming weeks and believe the low vaccination rate across the board will only make it worse.
A lot of people just don't know what they should be doing.
The latest numbers from the CDC show that only about 16% of adults in the United States have received the latest COVID-19 booster. This vaccination rate is much lower than experts had hoped.
Part of that may be difficulty in actually getting it out there. A lot of miscommunication about who should take it, who should not take it.
Health officials believe the initial confusion created a lasting impact. Officially, the CDC recommends that all people age 6 months and older stay up to date on COVID-19 vaccines.
In our most vulnerable population, that's very, very important. So our elderly patients, our patients with immune compromise, or those caring or living with those individuals.
However, some doctors tell us the reality is for everyone else, it's more nuanced for each person, especially when it comes to kids.
In the pediatric population, high-risk kids would have a much more significant benefit to it, but I see really low benefit at this point to children, especially if they've had COVID or a previous vaccine because they have the immunity.
If your child is healthy and isn't around anyone over 65 or who's immunocompromised, some experts say they may be fine without the shot.
There is no doubt that the COVID vaccines, at least for the short term, do keep people out of hospitals and worse. Okay, most kids are healthy and most kids, the overwhelming majority of kids, don't get hospitalized.
Locally, right now, doctors aren't seeing much of an increase in kids being hospitalized with COVID.
In the last few months, it's sort of stayed steady, more of like a plateau, maybe a little bit of an increase recently, but nothing significant.
But doctors agree the vaccine does still offer protection and reduces the chance for severe disease.
And the vaccines are safe and they are effective against the current variants. So it is worth getting.
And overall, they recommend talking to your doctor about what's best for your family. For more details, check out abcactionnews.com. James.